We have this this kind of parallel tracks that we're traveling on here. One is the intensification in real time of the epidemic, of the pandemic. At the same time, we're seeing folks get vaccinated, and there's a lot of hope that we can see toward the end of it. So as a physician, as somebody who tries to figure out public health policy, should we be hopeful here, or should we be ready to hunker down for a lot longer?
Well, I think it's both and. I think it is going to be a massive operational challenge, probably the biggest this country has ever had to undertake, to vaccinate all of its citizens in timely fashion. In the last 2 weeks, we basically averaged about 1 million doses of vaccine administered per week. We need to be getting to 1 million doses per day if we're going to reach the president-elect's target of 100 million doses in 100 days. And even then, when you consider these are vaccinations or vaccines that require 2 doses of vaccination, you have to multiply the American population by 2. So that's 660 million doses. Divide that by 1 million a day. That's 660 days. So we really need to be ramping up the pace at which we're doing vaccinations.
And how do we achieve that, ramping up the pace? What is needed that we don't already have in action right now?
Well, there's a couple pieces to it. One is the vaccine itself. We do have 2 vaccines, the Pfizer vaccine and the Moderna vaccine, which have received emergency use authorizations. We do have a certain number of doses promised by the manufacturers, but not enough to cover everybody. We do have some additional vaccines in the pipeline that may soon be receiving emergency use authorization, the J&J and AstraZeneca vaccines. But it's not just about the vaccines. You have to also get the vaccines distributed, and you need staff to administer the vaccines. And when staff are all tied up in ICUs that are overflowing with sick patients, it's very difficult to siphon off those staff away to do vaccination.
Now, we're talking about how long it might take and what's going to be required to get everybody vaccinated with, at this point, 2 doses, and maybe there'll be a 1-dose vaccine that speeds things along. But before we get to that point, I mean, there's a sense out there that, yes, January, without a doubt, is going to be grim in a lot of ways. Perhaps the death count lags, and we're going to see some, unfortunately, big numbers there. But as we get into the spring, and we might see some seasonal fall off, and you have a certain percentage incrementally of the population getting vaccinated, will that not calm things down in terms of transmission rates?
Well, that's really projecting pretty far off, frankly, and there's a lot that needs to happen between now and then to really see things improve. We are going to see one of the worst months in this nation's history in January. There is no doubt about that. And I think, unfortunately, that cake is in the oven, so to speak, already with the travel that's happened over the holidays. And, it was an interesting conversation you guys had over the break about airline flying. I think it's not just about being on the plane, to be very clear. What is concerning is that people are traveling from different places. These are people from different household bubbles who are spending time with one another, with different generations of people. That is the concern here. It's not the sitting on the plane that we're worried about. And that mixing of people is what leads to spread of this virus. And so there is no question we are going to see another surge, just like we did after Thanksgiving. We're going to see another surge in January, and hospitals are going to be facing that when they're already full.
Dr. Gounder, I know you're based in New York City, so just hearkening back to the darkest days in New York City and New York State in the pandemic, we saw tents in Central Park. We saw the Javits Center created for overflow. We had a ship come into the port to potentially service COVID patients. Are we going to go back to those days in varying forms across the country? Because what seems to be different this time around is that it's not just New York experiencing this massive resurgence. Other parts of the country are now seeing their darkest days.
Well, frankly, we're already there. We already have patients being treated in hallways, in parking lots. I think we are going to be facing field hospital situations in the coming weeks, coming month, just like we did at the Javits Center here in New York City. And unfortunately, while that care is the best that people can provide, that only goes so far if you don't have the doctors and nurses to staff those beds. And you cannot, you can't stand up new doctors and nurses the way you can field hospitals. You can't just create them out of thin air. And so this is going to be the limiting factor here for caring for all of these patients.
Shepard Smith here. Thanks for watching CNBC on YouTube.